What I would do if I've got acute low back pain. So by acute, I mean it's a sudden onset of low back pain, maybe related to something that you've done, but it's there and it's bothering you. And I would suggest the first thing to do is don't panic. It sounds really silly, maybe a bit simple, but it's really important not to panic. And the first thing that's going to come into most people's heads when something like this happens is, oh God, what have I done? Is it going to be like this forever? And there's a good chance, very good chance, that it's not going to be like that forever. Acute back pain is something that happens to almost everyone at some stage of their life, almost everyone. And it's so common in lifetime that it could be considered quite a normal condition. So don't panic. It's one of those things that will happen at some point, most likely, but for most people, it improves to the point where they can get back to where they were beforehand. Not everyone, but most people. I think the second thing that's important too is it's really tempting. It's a real double-edged sword. So I love the fact that there's so much information on the internet. I love that there's so much information on YouTube. I know that if I want to fix my dishwasher, there's a YouTube video about it. But it's really different with something like particularly low back pain. And if you go searching, Googling, hunting around for answers and try and self-diagnose, it's fraught with danger. And it happens more and more, not surprisingly, that people will come into the clinic and have an idea or about what's wrong with them and kind of tell you what they think is wrong with them, which is good to a point. Like I said, I do like that part of empowerment, people having access to information, but it really does come with some dangers. And one is that when people start reading terms that they don't quite understand, with pictures next to them that they don't quite understand, it can be frightening. And particularly if that's coupled with an MRI report that talks about a broad-based disc bulge, for example. Now, that term's okay if you understand what a broad-based disc bulge really means and what percentage of broad-based disc bulges happen in people that are asymptomatic, and whether that broad-based disc bulge is actually related to the pain that you're experiencing, but that's really hard to determine, particularly without knowing what you're looking for. And so you run the risk of ending up with a situation where people have this information that they don't quite understand, but increases their level of anxiety, which doesn't help. It's one of the factors that's definitely involved in pain is people's understanding or anxiety or fear about what's happening with their body. So that's the second thing. I'd actually suggest not hunting around the internet, not hunting around YouTube, not looking for the 5 best stretches for your low back, because they might work for the person next to you, but they might not be good for you. They might make things worse. The next thing that I'd suggest is, if you need to, it's okay to lay down a bit, but it's not helpful to be spending days in bed. Not helpful at all. And small amounts of rest is okay, but I think it's more important that it's a change of position. So if you've got acute low back pain, there'll be positions where you're more comfortable and positions where you're less comfortable. And for a lot of people, it's when they do one particular thing for too long or more than a certain length of time. So varying what you're doing is actually quite important. And movement is one of the things that is great in helping acute low back pain to start to improve. And if you think of it like this, when you're moving and when you're doing things that you feel safe to do, it's a positive signal being sent to your danger alarm system, your pain system. It's a positive signal to say that things aren't so bad, and it helps to bring the temperature down a bit, if you like, the urgency out of the situation to the protection system. So movement is really, really your friend. What kind of movement is the other thing. And like I said, in an acute situation, I wouldn't be jumping on the YouTube video that's got the highest number of views for the 5 best exercises for low back pain, or this is the number one exercise that's going to fix your acute low back pain. Well, you might be lucky and you might not be lucky. There's really no way of knowing just by trying it out. If you're willing to run the risk of making yourself sorer, then fine. But most people are looking for something that's definitely going to help. So in order to work out what that is, the best next step, in my opinion, would be to see your local physio, and particularly someone that has a good amount of experience and knowledge and training in managing acute low back pain. Now, anyone can stick a machine on your back and pretend that it's going to do something. Electrotherapy isn't part of the answer. So if someone's talking about electrotherapy, you can scrub them off the list immediately. A lot of people use dry needling these days, temporary pain relief. Like, it does have a neuromodulating effect. So maybe there's some benefit in that. I tend to go down the path with patients that come into our clinic. We all do, all the physios here. We look at an assessment process that's more based on trying to help people to work out with you and for themselves which are the best movements. Are there any movements that are pain modulating, that actually reduce pain and increase range of movement? And once you've worked that out, then you've got a path to follow. And that's where the Mckenzie Method comes in. It's a system to take people through a targeted history that helps to reveal whether there are any particular patterns, and then going through an assessment process that will help to reveal if there is a directional preference at that point in time. And a directional preference is simply, is there a direction of movement that makes things better? Does it reduce pain? Does it increase movement? Does it generally make things better? And once you've established that, it does make it easier to move on from there. Sometimes in really acute low back pain, there isn't a directional preference, and it is more a matter of managing this situation as it is and applying those principles that we've just been talking about until it becomes more of a problem that that allows itself to reveal a directional preference. The other thing is about what kind of medication to use. Now, we all know that opioids are, there's a real problem associated with opioids. There's nothing to suggest that opioids are better in acute low back pain. I tend to suggest people start with simple analgesia, just Panadol, paracetamol, whatever you want to call it, wherever you are in the world. Paracetamol, there's lots of ads here in Australia, or at least that talk about Nurofen and today's tough pain and all that kind of stuff. Anti-inflammatories have got their place too, but I tend to suggest people start with simple analgesia if they start with anything, and perhaps use heat if it feels like it's a nice thing to have a wheat bag on their back. That's fine. You're not going to do any harm by doing that. There's simple measures that you can do that might make it temporarily feel better, but just understanding that that's really all it's doing is temporarily making it feel better. So they're probably the basic tenets of how we manage acute low back pain. I think the most important part though is seeing someone that that has that level of, if you're going to go and see a GP or you're going to go and see a physio, seeing someone that does understand acute low back pain and they're familiar with it, and they're not just going to shoot you off for an X-ray or an MRI unnecessarily. And the guidelines are really clear on that in most cases, X-rays, MRIs and acute back pain are not warranted. And the only time that they are warranted is when there's cause for concern. If there are particular presentations, there are particular signs or symptoms that are worrying, that raise your suspicion for some of the more serious conditions. But for most of the time, that's not the acute low back pain people that we see. So, you know, don't expect if you go and see your GP or your physio to be sent off for an X-ray or an MRI, and don't browbeat them into getting you one either. Like, it's likely it's going to settle down. So I hope that's helpful. I hope that might take a little bit of fear out of the situation, because I really feel for anyone that comes into the practice with low back pain that's acute, and particularly if it's their first episode and they don't know what to expect. And I'm sure it's really scary. Well, I know it is. I've had acute low back pain too, and you do have those things go through your head where you think, oh God, how long is it going to last? Is it going to get any better? Am I going to be able to get back to doing whatever? Am I going to get back to being able to dig in the garden, or am I going to be able to get back to sport? But just rest assured that for most of the occurrences, it does settle down and it does get better. And if you are worried, if you are concerned, make an appointment to see your local physio or your local GP and get that reassurance that you need so that you can move on from there with confidence. Cheers.